Well, it's great to be back at a City Health International Conference, even if done remotely. This is saving me the travel expense and the jet lag, but I'm sorry I'm going to be missing seeing people in person. I was asked to talk about trust rather than fear, that empowering people rather than trying to control them or scare them. And I think this is a really key issue when we look at a lot of areas of public health and indeed a lot of areas of social policy. And it's been one for a very long time, that there's been this long tendency to look at things more in moralistic terms or authoritarian terms, telling people what to do, demanding that they behave in certain ways, rather than empowering them, working with them. And we've lived it. I mean, if we look at everything like the Inquisition or the battle that we had on the whole history of other public health issues, it's always been there and it still is. So right now with COVID, we're living it. I mean, even here in Ottawa, which is like a advanced, wealthy, progressive city, the immediate response to the COVID problem was an authoritarian one, not a public health one. It was, we better ban people from going into parks. There's no evidentiary basis for doing that. There's very good evidence to say that's a really bad idea. We'll tell them to just stay home. Lots of evidence that's a really bad idea, but it's a very authoritarian idea. It wasn't about promoting health and meeting people where they are and understanding their lived experience and the sort of things that the Ottawa Health Charter, adopted by the World Health Organization back in 1986, made clear, that it's the process of enabling people to make better decisions about their own health. And all that seems to just get thrown out the window as soon as some crisis comes along. And I think trying to understand that, because that's what we've lived on all these issues, whether the current ones such as dealing with drug policy, dealing with incarceration policy, dealing with nicotine, dealing with alcohol, dealing with sexual behaviors, but the history of so many other things, whether it be coffee or farm mechanization or even bicycles, that this tendency to look at things as it's a moral issue and we have to be authoritarian. Where does it come from and what can we do about it? And it's an area that has intrigued me all my career, and that I've worked on trying to reduce cigarette smoking since 1983. And embarrassingly, this should be a really simple issue. We knew by the time I started working in this field, people smoke for the nicotine, they die from the smoke. So simply dealing with the dirty delivery system would essentially solve the problem, our leading cause of preventable death. And here we are, almost 40 years later, and we haven't done it. And in fact, many of the people who claim they're working on public health adamantly oppose giving people a safer a system of getting nicotine. So we've lived this on nicotine. We've lived it on illegal drugs. We've lived it on so many things, and it's gone on way before any of us were born. Does it have to continue way after all of us are gone? So I think trying to understand, where does it come from? Why do we have these principles of public health that are ignored even by a lot of very senior people who are doing or say they're doing public health work? And I think to begin with, we can look at the sorts of things that work. So public health principles about empowering people, to facilitate them making better decisions about their health. It works really well. The principles of the Enlightenment, the sorts of things that Pinker writes about in Enlightenment Now, has been phenomenal. The increase in life expectancy, in quality of life, in health, in wealth, that if we pay attention to science, if we use reason, if we use humanism, we really, really get somewhere. And yet, whenever a new idea comes along, with saying, here's how we could do something better, or what you're doing now is not the most effective thing to do, like trying to say, actually not fining people for walking in a park is maybe a good idea if we're trying to promote health. every time a new idea comes up, there's opposition. Thomas Kuhn wrote about it in The Structure of Scientific Revolutions. Paradigms. People get attached to a certain way of doing things. They look at anything else as a challenge. It can be a threat to their standing. Juma talks about it in Innovation and Its Enemies. Virtually any new form of innovation is not just attacked, but attacked viciously. And the people will have vested interests. People will have professional interests. People will just not like change, but they will oppose these sorts of things. And they oppose them even more when they see some sort of moralistic reason to do that. The view that, well, of course we have to tell people not to go to a park, because what if a whole lot of people went in and then they got too close to one another? And you can't trust people, in Toronto, they put a fence around this huge park because they were afraid if people went into the park, they might stand too close to one another. That's one of these moralistic, authoritarian, stupid ideas. It's completely foreign to the principles of public health about empowering people. So when we're facing something like that, trying to understand, we know it's happened historically. Why? And I think part of the answer to that is, what we know now from things like thinking fast and thinking slow, that we tend as a species to come up with very quick, emotional, moralistic responses to new information or situations. So our amygdala is making rapid decisions. And then our frontal lobes are often used just to try to justify it. Like, I don't like this, and here's why. And we also know that from moral psychology that people have different operating systems. So we're often talking at cross purposes. So public health is usually built around the idea of autonomy. Give people the information they need, empower them, facilitate them to make better decisions. But there's a lot of people who see the world in terms of authority, that, what does somebody else say that I see as an authoritative source? What does the church say? Or what does the World Health Organization say? We just have to go with that. Other people have this sort of purity, sanctity view and it's very moralistic, of what you're saying is offensive. It's sinful, it's bad. And people respond in different ways, depending on what their moral, psychological operating principles are. And we need to know that. But I think one of the biggest problems we've had, and Levin's new book, A Time to Rebuild, talks about this, that we went from a time that institutions, education, research, science was something that would mold our thinking. We would adapt. If you're going to be at a university, what are the ways you should be trying to think things through? If you're writing papers, what's the role of peer review to hold you to account, to make sure you've really thought this through? That, if you're working for a major institution like, say, the World Health Organization or the Centers for Disease Control, what are the standards you have to meet in order to really be an acceptable employee there? That was the mold of, shaping the way that people would act, would behave, would think things through. But that seemed to get replaced with platforming. So instead of people saying, how can I become a better scientist to adhere to the standards of this organization, it's more like, great, now that I'm at the World Health Organization, I can get even more Twitter followers and I can really broadcast my views to the world. This allows me to say more how I feel about things. So you took a lot of that moral psychology, that quick thinking stuff, the moralism, the authoritarianism, and you simply gave it a platform. That I think that's why we end up with people working for organizations that are doing things that are really counter to public health. But it fits this personal ideological perspective they had and haven't had it sufficiently questioned. So we end up with even more of a problem. Like, what happens when people running organizations or working for organizations like the World Health Organization take essentially moralistic, anti-public health views about something and have the platform of working for the World Health Organization? So this creates a further challenge at a time where social media is adding to the challenges because misinformation is coming out, starting in many cases as disinformation, things that people are doing to purposely confuse someone, that is then being passed on by someone you trust who fell for it. And now you fall for it because you trust the source. It turns into misinformation. And so we end up with a lot of garbage research that isn't held back by decent peer review because universities become a platform rather than a mold. And then we end up with that information being passed on by what's seen as an authoritative source by people who believe in authority or trust the source that it's coming from. And we end up digging ourselves into a hole. And it's how we end up not questioning things like whether it's okay to walk in a park, where fear ends up being used instead of building trust. And it's a very powerful thing. So we had far more people calling snitch lines about people doing totally healthy things in parks than there were people protesting against, why on earth are you banning me from going to a park with my kid? So how do we change some of that? And I think the optimistic view of this is that many things have changed. Our views on so many things change. They change quickly. They change dramatically. If we look at attitudes toward interfaith marriages or interracial relationships or sexual orientation or attitudes as to how do we deal with something like AIDS, we have seen those changes. I think what we need are people to challenge, to look for evidence, to demand evidence for the policies somebody's trying to bring forward, to challenge authoritarian responses to any of the challenges that we face, and to fight back against institutions that allow platforming, that allow somebody to misuse the position they're in to promote a personal view rather than adhering to the science and adhering to public health principles. I think if we do something like that, we start to make a real difference. We've done it on many other issues. We can do it on the issues we're facing now. Thank you.